Hello everyone, welcome back to Exam Key Point Industry. So today we are going to study an important orthodontic topic, management of the deep bite. This topic is very important for BDS exam, Viva question and clinical understanding. And don't worry, in this video I will explain everything in easy English with a diagram and a simple concept. So first tell me in the comment, have you ever seen patient whose upper front teeth completely cover the lower teeth? Yes, that condition is called deep bite. So now let's understand it step by step. So deep bite is one of the most commonly seen malocclusion in orthodontic, and sometimes it becomes difficult to treat. So here now first understand the meaning of the deep bite. It means vertical overlap of the upper and the lower incisor. So normal overbite, it is usually 2 to 4 mm or around 30% overlap. And deep bite, when overlap becomes more than 4 mm or more than 40%, then it is called the deep bite. So how do we assess deep bite clinically? So it is very simple. Ask the patient to bite completely and then observe the overlap of the anterior teeth. So in this slide, the two images are shown, that is a normal bite and the deep bite. So in normal bite, the upper incisor slightly overlap the lower incisor, okay? But in deep bite, the upper incisor excessively covered the lower incisor. Easy, right? Now we see the types of the deep bite. So deep bite can be of two types, that is an incomplete deep bite and complete deep bite. So incomplete deep bite, in this condition, the lower incisors are not completely covered by the maxillary incisor, that is the upper incisor, or there is no contact with the palatal mucosa. Simple memory trick is the incomplete means not fully covered. Okay. Now second one is complete deep bite. So in complete deep bite, the lower incisor contacting the palatal mucosa. This may cause trauma to the palatal tissue, pain and ulceration. So this kind of deep bite often results in trauma of the mucosa palatal to the maxillary incisor. So which type is more traumatic? The answer is complete deep bite. So this diagram shows the normal overbite and increasing the severity of the deep bite. So then first figure you see, this is a normal overlap is present. In second figure you see, this is the overlap will be increasing, like this here it is increasing, the overlap will be increasing. Now in third, the lower incisor almost touch the palate. The lower incisor is almost touch the palate. So this is so here the severity gradually increasing. Okay. Now we see the key terms. Now let's understand some important terms. So here first one is cover bite. So this means the complete coverage of the mandibular incisor by the maxillary incisor, which is mostly seen in class 2nd division 2 malocclusion. Now the second one is closed bite. So it is closed bite due to the loss of the posterior teeth. It is mostly seen in adults. Okay, so because posterior support is lost, the anterior teeth overlap excessively. Okay. Now the classification, another classification of the deep bite. So first one is skeletal deep bite. So causes here is upward and the forward rotation of the mandible, and it can be due to downward and the forward inclination of the maxilla. So what are the features you see in skeletal deep bite? The first one is horizontal growth pattern, means the face appears shorter vertically. Second one is decrease in anterior facial height. Here the lower face height becomes reduced. Third one is decrease in interocclusal space, that is the freeway space will be decreasing. Now the fourth one is plane become the parallel, that is a front plane, mandibular plane and ascent plane, they all are becomes parallel. So is facial height increase or decrease in skeletal deep bite? The answer is decrease. Now the another classification is the dental deep bite. So dental deep bite is usually associated with an over eruption of the lower incisor, which is usually seen in class 2nd malocclusion. So features of the dental deep bite. So first one is increased overjet. So incisors to over erupt. So because of the incisor overjet, the incisor erupt will be more. Second one is increase in the curve of spine. So here the curve becomes deeper. Third one is the interocclusal clearance is usually normal as the molars are fully erupted. So here the interocclusal clearance remains normal. Okay. So here deep bite due to the intercepted occlusion. Now another cause, that is a deep bite due to the intercept occlusion of the molar. So here the molars do not reach the normal occlusion level. So premature loss of the posterior loss, and it can also be caused by the presence of the partially erupted molar. First one is, that is the molars do not reaching the normal occlusion level. So you see this is a molar which is normal, which is do not reaching the normal occlusion level. So therefore you see here deep bite. Second image, you see this is a normal level. So here there is deep bite does not present. Now we see the diagnosis. So diagnosis include clinical examination and the cephalometric analysis. Now, what are factors to consider? Now comes very important treatment planning. So before treatment, we decide, should we introduce teeth or extrude teeth? So introduction means moving the teeth inward and upward. So you see this is a teeth which is moving the inward. Extrusion means moving the teeth outward or the downward. So this is a extrusion, that it is moving the outward. Okay. So which teeth are commonly introduced in deep bite? That is an incisor. And which teeth are commonly extruded? That is a molar. Okay. Now the another factor to consider is lip relation. So if the patient has a gummy smile and excessive maxillary incisor exposure, then the treatment should be the anterior intrusion, because too much upper incisor is visible. So you see this is a before and the after image show. So there will be the gummy smile is present. So you see this is the image where the gummy smile are present, and this gummy smile plus there will be also maxillary anterior exposure. So here we do the anterior intrusion of the incisor. So the gummy smile will be reduced and less maxillary anterior exposure. Okay. Now the more factor is, that is a lip relation. So if patient has the normal upper lip plus 2 to 3 incisor exposure, then we cause the molar extrusion. Okay. So this is a normal upper lip plus 2 to 3 mm incisor exposure. Now after the molar extrusion, this will be released. This will be less visible of the incisor. Okay. So treatment better in growing patient and the extrusion of the molar improving the anterior facial height. So here important exam point is increase interocclusal space, that is a molar extrusion will be done, and in decreasing the interocclusal space, which is done by the anterior intrusion. Now the treatment options. So there are the three methods, that is the removable appliance, fixed appliance, and the myofunctional appliance. So the removable appliance, which is the most common. So first one is anterior bite plane. So it is a modified Holly's appliance. So anterior bite plane is most commonly used removable appliance for the treatment of the deep bite. The anterior bite planes is a modifier of the Holly's appliance. The anterior bite plane consists of the Adam class. This is the Adam class. Retention, that it is used for retention, and the labial bow, which is used for the counter forward force. Okay. So this is a red acrylic part in image is a bite plane, and it prevents complete posterior contact and help the bite opening. So the height of the anterior bite plane should be first enough to separate the posterior by the 1.5 to 2 mm, and it is used for the molar extrusion so that molar can come outward. Okay. Now the second one is myofunctional appliance. So here example is activator and bionator, and it is also mainly used for the molar extrusion. Okay. So here important point is anterior bite plane should separate posterior teeth by 1.5 to 2 mm. So why do we separate the posterior teeth? To allow the eruption and the extrusion of the molar. Now the second one is fixed appliance. So fixed appliance, the first one is anchorage bands. So mechanism is band is anterior to the first molar and the anterior part is positioned gingivally. So this is a band which is anterior to the first molar. The anterior part is present gingivally. Thus when archwards move occlusally, so intrusion force is exerted on the incisor. That is now the fixed appliance. Now the next one is reverse curve of spie. So arch wire with reverse curve of spie is used. So here action is it produces the intrusion of the incisors and the bite opening. So the curved wire help the label the extractory curve of spine. Okay, so this is a curve of spine normally, but this is a reverse curve of spine. Okay, so this curved wire help the exaggerated curve of spine. Now the next method is intrusion arches. So here features is its spring system attached to the molar tube. Okay, so here the buccal and the anterior segment. So here the spring system which is attached to the maxillary molar. So this is a maxillary molar which is spring system attached. So it is bypasses the premolar and canine. So you see this is the bypassing the premolar and canine. Then 30-degree turn. So then it will taking the 30-degree turn. Anterior segments typically, that is the anterior segment incisally provide the intrusion, and this is the anterior segment which is provide intrusion to the incisors. Okay, so the wire directly apply force on the anterior teeth for the intrusion. Now the next one is utility arch. So here the utility arch, the anterior segment in bracket slot, activating by the V-band buccal, and here it also the incisor intrusion. Now the next one is fixed anterior bite plane. So it is used for bite opening and correction of the deep bite. So this is a fixed anterior bite plane. So today we learned definition of deep bite, types, skeletal and dental deep bite, diagnosis, intrusion versus extrusion, removal appliance, fixed appliance and myofunctional appliance. So if this video helped you understand deep bite in easy language, then like the video, share with your BDS friend and subscribe to Exam Key Point Dentistry and comment below which orthodontic topic should I explain next. Thank you for the watching.